So we have a lot of questions from our viewers about the new COVID pill. So we definitely have Dr. Kohli here. She's going to talk about that and answer some other medical questions that are making headlines today.
And I'm here too.
You're not a doctor.
I know, but like that doesn't mean I'm not here.
How many years with medical school and with your residency did you put in?
17.
17. That's a child. That's crazy.
How about we call you pseudo Dr. Jackson?
See, I like that. I like that.
He has not even earned pseudo
Listen
Dr.
to the
Jackson.
doctor.
Sorry. Okay, so we got to talk to you about the new COVID pill by Merck. Am I saying that right? By Merck?
Yeah, it's perfect.
Okay, so this is what would happen. The patients would actually take it and it would battle the symptoms, but would it cure them? Does it prevent you from going to the hospital?
Yes, that is why I'm so excited. This is a huge breakthrough, you guys. The vaccine was number one. This is number two. So vaccine is prevention. This is treatment.
Wow.
Outpatient treatment. So before, when people called me, Jeff Jordan called me and said I got COVID, I told her you had to just wait it out, see what happens and hope for the best. Now we can reach for something. And if you take this pill, according to the data, they actually stopped the trial early because it was so effective.
Wow.
Decreases your risk of hospitalization by 50%.
Wow.
And nobody who got the pill ended up dying.
Wow.
Incredible, right?
Let me have a quick follow-up to that, Doc, because ivermectin's out there. A lot of people are talking about it, right?
Yeah.
So I just wanted to bring it up. How is this different than ivermectin?
It's quite simple. This works, and ivermectin doesn't.
There's no data that supports ivermectin.
There's no similarities in what's inside the pill itself?
Ivermectin is an anti-parasitic, so it prevents parasitic infections. This is an antiviral, so it actually prevents the virus from making copies of itself inside of you. And the nice thing about that, you guys, is that even if we get more variants, because it doesn't target the spike protein, we think this pill will even work for if we get variants.
When's it going to be available?
Yeah, so Merck has already started making it, which is something called at risk. They're kind of making it, hoping that the FDA will approve it. They're going to make 10 million doses by the end of the year, and they've already submitted it for authorization. So hopefully by next week or so, we'll start to have it available, which means that if you have somebody who tests positive for COVID, make sure you have them talk to their doctor about it.
Right away.
Oh, wow. All right. That's good news.
That's
let's
wonderful
stick on the topic of studies. There's a study saying that people that smoke cannabis are more likely to kind of have a breakthrough infection. Do you know if there's any truth to that?
Are you asking about yourself?
I don't. Well, I had to call it cannabis because that's why I sounded like an undercover cop. Like, who talks like that? Smoking cannabis. Right as my cover's blown for this gang I'm infiltrating. Yeah. Does smoking weed make this happen?
So here's the deal. Here's the deal with cannabis, as Al likes to call it, Dr. Jackson. Basically, there are a few different mechanisms by which it could potentially increase your risk of having a breakthrough infection. So if you think about when you're smoking, you're inhaling toxins into your lungs. So the immune system of your lungs, the lining, the mucus, all the stuff you have in there to protect you, starts to actually get activated by those toxins, and it works less effectively against protecting you against COVID. So it increases inflammation in your lungs. That's one. The second is that when you're high, and I've never been high before, so I'm going off of what I've heard from other people, but when you're high...
You notice the silence from this end of the table.
You are basically, just not keeping your guard up. You're misbehaving, right? You can be doing things that could increase your risk of catching the infection. And so what I tell my patients, because here in Colorado, it is legal, marijuana, cannabis, weed, whatever you want to call it, is that it's better to use edibles than it is to smoke, because you can potentially get some of those effects that make you feel better, use it recreationally without necessarily having that inflammation in the lungs.
Great advice.
Right.
Okay, we got to switch gears here because a lot of our viewers are talking about this. Queen Latifah has joined a new campaign to destigmatize obesity called It's Bigger Than Me. She says she was shocked when a doctor told her that she, Queen Latifah, was obese. Can you help us understand what that actually means?
Yeah, so I have a real problem with the way that we define obesity, because it's just a simple calculation that takes your weight in kilograms and your height in meters squared. And so if you're a short person with a lot of muscle mass, you could potentially be obese. And in fact, if you look at the numbers, 36 to 42% of Americans are obese. So a lot of us fit into that category, but I really want us to stop talking about it like it's a label. It's not like like being blonde or being tall, or it is a medical condition. It's like hypertension. It's like diabetes. It's like cancer. And if we start thinking about it that way, guys, I really think we'll start to treat it, because it's undertreated, it's underdiagnosed, people are afraid to admit it, and it's associated with heart disease, cancer, stroke, all kinds of things. So I don't know, how do you guys feel about changing the way we think about obesity?
I think we need to have a good talk about it, right? Because I think there are many, many major benefits, right, to staying healthy. But what does healthy mean?
Right.
That's the question that we have to answer.
I hope one day some patient walks into my office and says, "Doctor, I have high blood pressure, diabetes, and I'm obese." I am waiting for that day.
Wow. Always a pleasure having Dr. Kohli on here. DBL Nation, if you have a question you want
She's the
answered
best.
by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com.